Hello friends, welcome back to Complete Medical Coding. Let's move and discuss more and more mock questions. But today I'm here with one of an important descriptive mock question. Let's look into that mock question in this video. Okay, friends, if you are new to the channel, please support me by subscribing to the channel. Let's look into the question. Let's move on to the question. Let's look into the question. Preoperative diagnosis, left breast carcinoma. Postoperative diagnosis, left breast carcinoma. Name of the procedure, left lumpectomy and sentinel node biopsy. Description of procedure. See, this is how a descriptive question looks like. As I told you, as I had mentioned in the last episode, when you answer the descriptive question, you have to carefully analyze what is preoperative diagnosis, what is postoperative diagnosis, and what procedure is being done. Description is just how the procedure has been carried out. That's what they have mentioned, but still you need to read it, the whole description, because sometimes from that you need to add some add-on code or some modifiers like that. Okay, so here in this question, preoperative diagnosis is the same as a postoperative diagnosis. Sometimes it will change. Sometimes preoperative diagnosis means it's just to rule out left breast carcinoma. That is preoperative diagnosis. And what is postoperative diagnosis? After the operation or after the procedure has been done, what does the doctor concluded? That is a confirmed diagnosis, postoperative diagnosis. So preoperative is an unconfirmed diagnosis. It's only to rule out the diagnosis, and postoperative diagnosis is the confirmed diagnosis. So you have to always code for the postoperative diagnosis. Don't simply look on the preoperative operative diagnosis and then marking. It will show error. It will come into the wrong answer. Okay. So anyway, here, since the preoperative and postoperative diagnosis are same, you don't have to worry much about that. Okay. So here both are same, left breast carcinoma. So we have to code for the postoperative for the left breast carcinoma. Okay. Anyway, let's read the question. And then what is the procedure carried out here? Left lumpectomy and sentinel node biopsy. So you have to code for both the procedure, left lumpectomy and sentinel node biopsy. Okay. Now let's move to the description of the procedure. The patient is a 65-year-old female admitted with a diagnosis of left breast carcinoma. Risk and benefits of the procedure had been discussed pre-operatively, including risk of bleeding, infection, deformity in the breast, chronic pain, lumpness, chronic lymphedema associated with the lymph node biopsy, as well as other possible complications. The patient agreed, PT means patient, okay. The patient agreed to proceed. Because the wire was located in the upper outer quadrant of the breast over the lesion and length of the wire was 10 cm, it was felt that it would be best to approach the node biopsy as well as the lumpectomy through the same incision in the upper outer quadrant of the left breast. Incision was made with a 15 blade through skin and subcutaneous. Hemostasis achieved with Bowie electrocautery. Flaps were formed in the usual manner. A wire was brought out through the incision. We then circumferentially removed all the tissue around the wire down to the tip. We marked the specimen with a long lateral stitch, short superior stitch, 2 lateral clips and 1 superior clip. We were able to identify a hot node in the axilla and at least 2 lymph nodes that were blue dyed within the sentinel nodes. We did perform lymphoscintigraphy and injected 2 cc of methylene blue dye in the periareolar area pre-operatively and massaged the breast for 5 minutes. The lymph nodes were excised and a biopsy was performed on the axillary node. At this point, we copiously irrigated the area to assure good hemostasis. We placed clips throughout the entire cavity. We then closed the deep dermal tissue with interrupted 3-0 vicryl sutures and then closed the skin with a fine 5-0 nylon. The patient tolerated the procedure well. Sponge count was correct. Blood loss was minimal. The patient was sent to the recovery room in stable condition. What are the codes for these procedures? So here in this question they have not asked me to mention diagnosis. They are asking only the procedure code to be coded. We have to code only the procedure code. Okay. So what are the procedures carried out here? As I mentioned earlier, left lumpectomy and sentinel node biopsy. These two procedure has been carried out. Anyway, after reading the description, I think you like little summary you have to find it out if there is any other procedure done, any additional, not procedure, we cannot say it as a procedure, any additional service has been carried out. Okay, and like in the at the end, if there is any complications or if the patient is not in a stable condition, all those things it will come in the end of the description, so that you have to just find it out. Anyway, here everything is in the normal condition. Okay, let's move to the codes one by one. What is the first code? 19120. What is 19120? Just open the CPT code book. 19120. is excision of cyst, fibroadenoma or other benign or malignant tumor, aberrant breast tissue, duct lesion, nipple or areolar lesion, open male or female, one or more lesions. Excision of cyst is mentioned here. First, let's look into the lumpectomy. We are first coding for the lumpectomy procedure. Okay, the removal of the lump. Lumpectomy is removal of the lump, but it is from which part? From the breast. Okay, left breast. So 19120 is excision of cyst is mentioned. Let's check the other intercommentary code 19301. What is 19301? Mastectomy partial. See, mastectomy partial. See, when you see the term, medical term mastectomy, don't think that mastectomy partial means left breast fully is removed. Okay, this is not the code. Don't think like that. You have to check for the whatever is mentioned in the bracket. See, it's mentioned there lumpectomy, which is what we need, right? Mastectomy partial, example lumpectomy, tylectomy, quadrantectomy or segmentectomy. Anything can be done. Removal of mass, a quadrant, a segment, all those that you can code under this procedure, mastectomy, and also it is written partial. Partial means only one. Okay, so we don't have to append any modifier for this code. So 19301 is what we need. What is the other intercommentary code 19302 in option C? 302 is with axillary lymphadenectomy. There is no lymphadenectomy performed in the question. If it is performed, you have to code this one, 19302. There is nothing lymphadenectomy performed. If you can see almost 4-5 lines from the end, lymphoscintigraphy, that is not lymphadenectomy. Don't mistake it as lymphadenectomy. Okay, that's why they have given this code in the option to make you confused. And in option D, it is same again 19120, which is wrong. So, see, while checking only the integumentary code, you got the answer, right? As the code 19301, it is present in only one option. You already got the answer as option B, 19301. Okay, this is how you can save time. Now I took almost 10 minutes because I was just explaining you, but within 2 or 3 minutes you can simply answer this question because you already found the CPT code, integumentary CPT code. If you are checking for codes, first you have to sort it out which code needs to be find out first. So by that you can save time. Okay, if it is integumentary code, you have to first find the correct integumentary code, and then go to the other code, the biopsy code. Okay, anyway, we already got. I'm not lengthening the video. You will also get bored. So let's look into the biopsy code now. Anyway, you already got the answer, option B, but still we will, and just explain the other two codes also. What is 38525 in option B? 38525. 38525 is the biopsy. Biopsy or excision of lymph nodes. Open deep axillary node. 38525. Biopsy or excision of lymph nodes. Sentinel node biopsy. That is excision of lymph nodes. That is what is mentioned in almost in the middle. If you can see how the biopsy was carried out. It was felt that it would be best to approach the node biopsy as well as the lumpectomy through the same incision in the upper outer quadrant of the left breast. Then incision was made, hemostasis was done through electrocautery. Okay, see, hot node in the axilla. If you can check in the middle, almost in the middle, you can see hot node in the axilla. So this is the axillary node. That is why we are coding 38525. Okay, axillary node. Along with modifier 51 and LT. You already know 51 means multiple procedure because here multiple procedures are being carried out. And in the left side, so we are coding with modifier LT. Now one more code is mentioned, 38792. What is 38792? Injection procedure, radioactive tracer for identification of sentinel node. As in our procedure, in the beginning itself it is mentioned, name of the procedure, sentinel node biopsy. So for sentinel node, you have to code this procedure. You have to append this procedure 38792. Injection procedure. Okay. Radioactive tracer for the identification of sentinel node. For excision of, see in the bracket what is mentioned. For excision of sentinel node, you have to code from 38500 to 38542. For nuclear medicine, lymphatics and lymph gland imaging, use 78195. For intraoperative identification of sentinel lymph nodes, including injection of non-radioactive dye, you have to code all these. So according to the question, you have to answer. Okay, what is the meaning of this one, radioactive tracer for identification of sentinel node? See, almost in the not middle, 3/4 of the line, if you can see, we were able to identify a hot node in the axilla, as I had mentioned before. Okay, and 2 lymph nodes that were blue dyed within the sentinel nodes. We did perform lymphoscintigraphy. That is what is this radioactive tracer. Lymphoscintigraphy. That's why I had mentioned you earlier. In the description, you have to read the description carefully, so that maybe one more add-on code you will get. So here, instead of coding 2 codes, you have to code 3 codes, right? Lumpectomy, biopsy, and then this procedure. See, they had performed lymphoscintigraphy, which is the radioactive tracer for identification of the sentinel node. So you have to code that also as a multiple procedure, append modifier 51 and modifier left LT. Okay, anyway, if you have confusion, that's why I had mentioned you step by step you have to find out the code so that you can eliminate the other options. So here, as I had mentioned, you had got the answer as option B 19301 for coding lumpectomy. Since it is partial, since the description of the procedure is partial, lumpectomy partial, you don't have to append any modifier. 38525 with modifiers 51 and LT. 38792 again for coding lymphoscintigraphy. Okay, there is a radioactive element, that is a lymphoscintigraphy procedure. Okay, with modifier 51 and LT. This is how you need to find an answer for a descriptive question. So friends, this is one of an important descriptive question as I had mentioned. Now moving on, within 1 or 2 days I'll be coming back with more and more questions. Okay, it's hard time to discuss more questions, so please stay tuned for more videos, and if you like this video, please like and share, and if you are new to the channel, please subscribe to my channel. Please support me, and thank you for all of my friends who had already subscribed and supporting me. Okay, so if you have any queries, please mark it in the comments and I'll get back to you soon, as soon as possible. And if you guys need any more questions, you can always contact me, you can always message me. Okay, so thank you so much friends, and stay tuned for more videos. Bye, take care.